Hi, my name's Rachel, and today I'm going to show you how to do a medication insertion via secondary or piggyback. So before I begin, I'm going to check the patient's orders against the MAR. I'm going to verify any allergies or labs. I'm also going to verify which medication the doctor has ordered. So in this case, the doctor has ordered vancomycin, which vancomycin is an antibiotic. It binds to the cell wall, causing killing of bacteria. It's contraindicated in patients with renal disease or impairment. Some side effects could be muscle pain, cramps, bloody or cloudy urine, nausea, or fever. And the labs you should monitor are creatinine and BUN. And the recommended dosage is 500 milligrams every 6 hours, 4 grams a day. And you should always monitor the site for infection. So in this case, the doctor has ordered 0.5 grams. So I have a 500 milliliter vials, milligrams per milliliter, and in that case I'm going to administer 1 milliliter, which is 0.5 grams. To find the flow rate, I'm going to take my 50 milliliters over 60 minutes times 10 drops per milliliter, which is the recommended drop factor for the tubing, and that's going to give me 8 drops per minute. So now I'm going to prepare my vancomycin. So I have my 50 milliliter piggyback. I'm going to wash my hands, and I'm going to draw up 1 milliliter. I'm going to clean this with alcohol. This, and then draw up 1 milliliter. After I have drawn up my medication, I'm going to label the bag with, I'm going to label it with the drug, the dose, the patient's name, my initials, and the time. And I'm going to inject the vancomycin into the mini bag, or the secondary bag, piggyback. And I'm going to go ahead and prime my tubing. So I'm going to insert the last port. Go ahead and hang this up. Unclamp this. Okay. And that is primed. Go ahead and hang my primary line below and make sure my primary line is clamped off. Okay, now I'm ready to attach. So I'm going to clean the port with alcohol. And before I attach, I'm going to label the tubing with the date, time, and initials, and I'm going to wash my hands, and I'm going to put on a pair of gloves, and I'm going to walk in the patient's room. Sorry, it's been a long day. I'm going to walk in the patient's room, and I'm going to check their name and date of birth against the wristband, assess for any allergies, make sure that the patient is aware of the procedure, and also make sure my tubing is labeled with my date, time, and initials. And now I will prepare to insert the port, but I will clean it off with alcohol before I insert. Okay? So clean this off with alcohol. And I will make sure that my drops per minute is intact. So in this case, it was 8 drops per minute. Go ahead and unhook this and roll this until I have 8 drops per minute. Okay. And I'm going to assess the IV site for any phlebitis or infiltration, make sure the patient's tolerating the procedure well, and then I will come back in the room and check on it periodically and then once it's finished, I will prepare for removal. So in this case, I will come in the patient's room, verify their name and date of birth against their bracelet. I will take off old gloves, wash my hands, put on new gloves, and then I will go ahead and clamp this off. And unclamp my primary bag. Remove this. Make sure that's clamped off. And I will set the drops per minute back to the original doctor's order on the primary bag. Okay. And now I will inspect the IV site again for any phlebitis or infiltration. And now I'm ready to document. Right? Okay. So I'm going to dispose of my needles in the sharps container, and now I'm going to document against the MAR. I'm going to document the rate, the time, the medication or the volume of the medication infused, my date, the time, my initials, how the patient tolerated the procedure, how the IV site looks, and any additional instructions that I gave the patient.